Coming up. For the first time in 5 years, Eastside San Jose moms can give birth in their own neighborhood hospital.
It's gratifying, and it really gives a sense of hope and light during a very dark time.
We then sit down with Santa Clara County's first Vietnamese American County Supervisor Betty Duong.
As the first of community electeds, right, is that we gotta make sure we're not the last.
From spearheading a new homeless partnership between San Jose and the county, to a heated election to save healthcare funds.
If Measure A doesn't pass, we will have to close down healthcare systems. We will have to cut service lines. We will have to lay off people.
It's all coming up on KRON4's.
All right, let's go. 3, 2, 1.
For the first time in 5 years, the birthing unit in Eastside San Jose's Regional Medical Center is open.
Which makes it both logical and necessary to reopen labor and delivery services at Regional Medical Center.
Regional Medical Center is going through a renaissance. Since threats of shutting down and layoffs, the county then decided to buy the hospital from private control. Now things are looking up. The trauma center is back online, and so now the birthing center.
It's now time for babies from Eastside to be born in Eastside again.
Not only is Eastside San Jose celebrating its new birthing unit, it's also celebrating new representation in the first Vietnamese American County Supervisor Betty Duong. Her family survived on county support in San Jose, and for her, this is full circle. We sat down with her for a one-on-one interview. This is one of my favorite interview locations I think I've ever seen in a hospital room. I feel like in life, a lot of times when you're in a hospital room, it's not the greatest setting to be in.
It's not a good reason, yeah.
But being here in this hospital room with that little carriage right there automatically makes you feel like this is a more positive experience. So sitting here right now in this hospital room with that carriage there behind you, how does that make you feel?
I feel incredibly grateful, very privileged. I feel an incredibly heightened sense of emotion as well. It's very moving to be here today. So being here post-pandemic, being here during the transition of ownership to the county organization, seeing how so much was laid bare. This floor was empty. The labor and delivery unit had been removed from Regional Medical Center by the previous owners in 2020. So to walk through this floor empty was really heartbreaking, to know that in the last 5 years, over half of all births at the county health system was, the babies went home to Eastside, to this community here, and not having something immediately available for them was both painful, heartbreaking, and disappointing for myself, but also inspiring to meet the challenge, right? We know what our community needs. We know that moms deserve to deliver safely in a community that is familiar and home to them. So being able to see the baby carriage here, to see all the different enhancements that have been made to prepare this floor for new babies to be born, for moms to deliver safely, it's emotional, it's gratifying, and it really gives a sense of hope and light during a very dark time.
Big changes coming just as you get elected into the County Board of Supervisors. It almost kind of coincided, the county ownership of this hospital, with you being elected. How do you see your role kind of advocating for this area going forward, especially with this hospital?
Well, I've had the privilege of working at the county for the last 11 years prior to taking on the role of county supervisor. So I'm no stranger to budget, policy, and the promise to community. And our promise and our commitment to maintain the safety net. Now, as I was heading into office, I knew it was going to be a hard job. I knew that it was going to be tall order with just what was right in front of us. The onboarding of Regional Medical Center, investing in health and wellness and access and equity here in the East Side, which has been historically deprived of all of those things for generations. So then to have that then compounded by what's happening on the federal level, the task has never been more important. The challenge has never been more great. I don't think the mission has ever been more noble than today, and it's daunting. We have daunting challenges and a very bleak landscape ahead of us, but Santa Clara County is known for doing the impossible. And we are known for leading with our values first, time and time again. So I feel very fortunate to be serving on a board of supervisors with colleagues of shared values and like mine. with a county administration that knows that they show up for work every day committed to the well-being of the most vulnerable. And this hospital is a shining example of that commitment, those values.
Definitely. We could talk a little bit more about the hospital in a minute, but East Side San Jose.
East Side.
You mentioned it's been neglected for years. How do you think we got to that point?
Well, I think generations and decades of redlining, of deprivation of services, of being ignored, structural, systemic racism and biases against communities of color, immigrant communities, and the poor. And I'm not saying that's what's happening today. What I'm saying is the work today is to undo generations of that type of impact. And so we start first with health equity and health access, which is what the county specializes in. But District 2 is the district I represent. It's the east side, the downtown district. It's no wonder that we are the smallest geographical footprint with the same population size as the other 4 districts in the county. That means we're multi-generational households. We are population dense. We have people living on top of each other, some by choice, many by necessity. My district has over half of the county's unhoused population. We have the highest rate of food insecurity, poverty, health disparities here in District 2, and that's the East Side community. But this is also the district of resilience. This is a district that has been known to fight for everything: fresh air, healthcare, a hospital, parks, roads, systems that are worthy of our families and our future generations. This is the district that knows how to turn $1 into $5. They know how to huddle up and support each other. This is a district that defines what mutual aid looks like at the ground level in communities and neighborhoods.
I think doing my research before this interview, I've known this statistic for ever since you were running for office, but it just dawned on me. Vietnamese Americans have been in San Jose for almost 2 or 3 times as long as I've been alive. But you're the first Vietnamese American to the County Board of Supervisors?
Yes.
It's about time, right?
I would say, yeah, there is an element, it's about time, right? And it's also a full circle moment too. It was because of the County Board of Supervisors that Vietnamese Americans were able to resettle here. In the late 70s, Santa Clara County became one of 3 congressionally designated refugee resettlement sites for immigrants and refugees coming out of the Vietnam War. And so people often wonder, why are there so many Vietnamese folks here? Well, there's plenty of reasons you could see today: the weather, the community, the environment, the diversity, the solidarity. But how did that start 50 years ago? It was because the Board of Supervisors and the community activists and leaders here said, we will receive refugees from Vietnam. It's what we do here as a community.
How do you feel your representation kind of charts your path going forward as a supervisor?
Well, being the first of anything, right, requires a great sense of responsibility. So as the first Vietnamese American, even if I didn't set out to represent the whole culture, by default, I am representing the culture. So making sure that we are able to show our allies, our communities, our neighbors, this is what you can expect from representation in the Vietnamese American community, that we are going to be working together collaboratively in community with one another, that there's a role for me here too to also help cement, help anchor, help share the history, the culture of Vietnamese Americans, that we have made contributions to this community. We are part of the fabric of East Side and Santa Clara County in San Jose, and that we're all in this together. So moving forward, really one of the critical, missions I have, one of the responsibilities I have, as do other as do women electeds, as the first of community electeds, right, is that we gotta make sure we're not the last. That I also do my part in supporting civic engagement, fostering civic engagement amongst our next generation of women leaders, Southeast Asian leaders, immigrant leaders, Vietnamese leaders, AAPI leaders. That's a task that
Definitely.
I joyfully and willing to take on.
First year as an elected Board of Supervisor, already making a lot of waves when it comes to how the county's working with the city of San Jose. Mm-hmm. I was telling some of the people earlier today, as a South Bay reporter, I feel like 90% of my stories about homelessness, I talk to the city. Mm-hmm. Hardly do I talk to the county. Mm-hmm. I think you're trying to change that definition or change the way they work together. What did you see kind of, I don't want to say wrong mm-hmm. with the approach before you took office? I guess that's how I would phrase it, because you're trying to change it, right?
Trying to build on it, right? Trying to change it, trying to build on it. I just want to also point out that the work that the county is doing around homelessness, housing, affordable housing, and homelessness prevention, just like cities across, just like San Jose, just like counties and cities across the country, we are facing a new form of homelessness that is in its crisis stage, right? I think homelessness and housing insecurity, there have been elements of it throughout our city. I was born and raised in San Jose. I remember growing up in downtown, growing up in East Side, that we do see the occasional unhoused person. But what we see today is so different from what we grew up with. It is now a full-blown humanitarian crisis in our own front yards, our backyards, our streets. And we just have to remember that no city and no county has had to deal with it at this level before. So as we're addressing the challenges, we're also, the old saying, building the plane as we fly it, and we're learning, we're pivoting. And so the change here is, I would say it's more of course correcting based on what we learned, lessons learned along the way, constantly improving our systems and our operations. So if we always have a growth mindset of how to be better at our job. And one of the avenues of being better is merging our systems and making sure that the city system and the county system to addressing homelessness, whether it be through our interim shelter system, homelessness prevention system, long-term permanent supportive housing system, that we're doing it in tandem and partnership with each other so that no one has to be subjected to applying twice, being bounced between city and county systems, or falling through the cracks that were unintended consequences, right, of our systems not fully being integrated with one another.
I think just to dive into that a little bit more, I think every time I've talked to the mayor about homelessness solutions, he's had one of his talking points where he says, I need the state to have a more robust framework, and we're calling on the county to do more. Mm-hmm. And we never really heard the county's side of that. I feel like for a long time it was kind of like, you need to do more. No, we're doing enough. You need to do more. And so I think you're trying to bridge the gap there, right?
I think I'm trying to bridge the gap, and I think this is where I really feel that my background as line staff, as an employee who was working deep in the bowels of bureaucracy, can come to bear in a way that's value add. I know that at the line staff level, at the administrative level, our county and city employees, the ones who are the outreach workers, the program managers, the contract managers, the auditors, the systems improvement, the policy people, right? They're working night and day. This is their whole life. They eat, breathe, live, sleep, dream, stress, worry, find their joy in their work. Homelessness prevention, intervention it's not just their bread and butter, it's their whole lives. That's what you see when you work at the line staff level. They do this every single day. At the policy level, as electeds, we see the outcome, right? The aftermath, whether communities are improving or not. We hear from our neighbors. So I think there's different tracks that we're operating on. And you're right, the county, I think in my memory too, the county rarely says, oh, you need to do more or you need to do more. I think what we've been trying to do is we're trying to understand where more needs to happen. And I think that I would love to be able to put my stake in the ground that we need to do more together. Bridge the gap, and I also want to acknowledge the mayor, the city has been really great partners. My most recent referral was done in partnership with the city of San Jose and with Mayor Mahan specifically to merging our interim shelter systems together so that it's no wrong door, one coordinated entry system, and also throughput. How do we now merge our systems in a way that exits people towards long-term supportive housing or sustainable and housing stability better, quicker, and more in a more lasting way?
Federal administration is cuts around the nation. And where we're sitting right now is now a county-run hospital.
Yep.
One of the several hospitals that faces severe cuts. I talked to a doctor about a week ago who said that these cuts are life or death if they don't pass Measure A.
Yep.
Where do you stand on that, and how vital would you say that funding is?
It's absolutely vital. Where do I stand? Let me just start by saying that my family, my sisters and I, myself, we were raised on county services. From healthcare to social services to food stamps and housing, everything that was critical to being able to live and exist was a result of county programming services. And the federal cuts that are happening right now and continue to roll out through 2027 is attacking the very same systems and programs that raised whole generations of San Jose residents. So these cuts are life and death. If Measure A doesn't pass, we will have to close down healthcare systems. We will have to cut service lines. We will have to lay off people. And just to put it in some perspective, Measure A is projected to generate $330 million a year. $330 million is equivalent to 1,400 full-time codes in the healthcare system. We're talking about 1,400 nurses, doctors, techs, aides, assistants, healthcare providers. That's a whole hospital. And so with 5/8 of a penny sales tax increase on retail goods, not necessities, these are only taxed, this increase is proposed only for non-essential items, retail goods, for a period of 5 years. That will allow us to have the cushion necessary to keep our health and hospital system going as we know it today, while we continue to improve and refine our operations to fit this new reality that the federal administration has created. This is not a temporary situation. This is the HR1 and this federal administration has fundamentally forever changed how counties operate across the country. And it now changes in a way not for the better, but in a way that we are no longer able to provide health care. We are no longer able to provide food support. Also in HR1 is our ability to provide homelessness intervention prevention services. Just when we're about to start making gain, the rug's been pulled out from underneath us.
Vast majority of electeds I've spoken to about Measure A are in support of it. You have the Cupertino mayor, however, who said we should take a step back and look at why the county got here in the first place and is funding 4 different hospitals, and therefore she's against it. What do you say to that criticism?
I would say it's unfortunate that our Cupertino mayor is woefully underinformed or misinformed about our healthcare system. It's complex. It takes time to study and understand it. So I guess some people have not had the opportunity to do that, or maybe the will to do that. But we have 4 hospitals, level 1 and level 2 trauma centers, to serve 2.1 million residents of Santa Clara County. And Santa Clara County is just not any other county. This is a county that is bustling. It's innovative. We're about to usher in the greatest year of sports enterprise into our Santa Clara County. And by the way, none of the revenue comes to counties. All the revenue from this sports bonanza goes to the cities that are hosting, which is a good thing. I'm not saying that to complain. I'm just saying, look, we're doing our part to make sure that we uplift Santa Clara County both economically, health-wise, public safety. I'm using that as an example because to be able to have the games come to Santa Clara County, the county is responsible for the health and safety infrastructure to be able to absorb millions upon millions of visitors. So just in that instance alone, we're so lucky to have the county run 4 top-tier hospitals, where our hospital system ranks top in the nation across all metrics and measures. It serves 2.1 million people. If we didn't, it was not an option to not purchase the hospitals. Had we not purchased St. Louis right before the pandemic, the residents of South County, of Gilroy and Morgan Hill, would not have had a hospital to go to. We would have lost hundreds of beds to be able to put people in. Had we not purchased Regional Medical Center, Eastside would have been left without an emergency room, without a level 2 trauma center, without beds, without access to healthcare for a community that was already deprived of access to healthcare. When an emergency department goes down, it will uproot the whole medical care system of Santa Clara County, both private and public. So it's something that I hope most folks I talk to understand this. And what I really hope to impart is that our health and hospital system, both private and public, just think about it as hospital beds. Every single hospital bed in Santa Clara County, in the 15 cities, in this population of 2.1 million individuals, are in very delicate balance with each other. Where we send ambulances, where we send worst case scenarios, car accidents, traumas, spinal cord injuries, is dependent on what beds are available and what specialties exist. All of that hangs in delicate balance with each other. So if any one of our hospitals are to go down, that community suffers first. So when someone says to me, close down a hospital, sell a couple hospitals, course correct your budget, I ask them, great, if that's the course we take, which community are you willing to let die first? because that actually is what's going to happen.
So, with all that said, lots of moving parts
Yes.
as you chart your future as a supervisor for the county. Lots of new things coming into shape, especially where we are right now. Final question: as you navigate the rest of the day, walking through this hospital, what's going to be on your mind?
What's gonna be mine is how do I work every single day to not just make Eastside and District 2 healthier? How do I make this the healthiest district in the county of Santa Clara? How do we become the model of what well-being, community-centered services, what that could look like? And I'll be looking, and that's what I do. I constantly walk the halls of our hospitals, of our county buildings. I come here regularly, probably every other week, just to visit, have lunch in the cafeteria, just to see how things are going, and look for ways to be supportive as possible. And how do we take the policy level decision-making process down to the operational level to make sure that our decisions translate into immediate positive outcomes for our staff to deliver better care every single day.
And this is just one big metaphor for it, this whole unit being reopened.
Yes, one big metaphor for this whole unit being reopened. Babies will be born in Eastside again. Moms will deliver safely. Families will be able to convene and congregate around spaces that are familiar and home to them.
Awesome.
Yeah.
Sounds great.
Thank you.
Thank you, Supervisor.
Thank you, Chad.